Hello, everyone. Allow me to start by introducing myself. My name is Aldisi. I'm a certified clinical dietitian, currently working in the country of Jordan in my own private clinic, in addition to being Ru'yas TV exclusive dietitian. Today, we are going to be talking about obesity in relation to the non-communicable diseases, prevention and management approaches. If you want to start by having a quick introduction, as we all know, obesity is generally at a very high prevalence among adults and children with Down syndrome. Unfortunately, it may hinder the care of these individuals and ultimately leading to the reduction of the quality of life. Obesity generally increases the risk of various non-communicable diseases, including dyslipidemia, insulin resistance, type 2 diabetes, and hypertension. Fortunately, we have had promising results. These results show that the life expectancy of Down syndrome children has been growing in the last decades, from 35 up to 60 years old nowadays. And thus, today we are going to explore the role of different approaches to prevent or treat obesity with regards to the non-communicable diseases. Generally, Down syndrome is related to various health problems, which include hypothyroidism, decreased resting metabolic rate, low level of lean body mass, increased leptin levels, mastactory dysfunction, behavioral tendencies, in addition to short status. If you want to start exploring each one and every one of these options or every one of these conditions alone, let us start by hypothyroidism. We generally know that this gland is the most important endocrine gland in our bodies, and it is responsible of the production of the thyroxine, T4 and T3 hormones in the body. Generally, hypothyroidism is a common congenital or acquired condition, especially for the autoimmune dysfunction linked to Hashimoto's thyroiditis in the Down syndrome children. Generally, these two hormones play a crucial role in the body, which include cell differentiation, maintaining thermal and metabolic homeostasis, in addition to the interference in the carbohydrate, protein, and lipid metabolism. The prevalence of hypothyroidism in the Down syndrome population is higher generally than their counterparts. In addition, some studies classify it as the second most medical condition in Down syndrome. And thus, parents should really remain alert to the clinical signs of hypothyroidism, which include weight gain, tiredness, constipation, delayed growth, hypotonia, dried skin, and alopecia. If we can realize these clinical symptoms ahead of time, and if we can generally test the hormonal levels of T3 and T4 every 6 months, we can reduce the risk of obesity and manage the risk of obesity in Down syndrome children and adults. Moving on to the next problem that may lead to obesity or may increase the risk of having obesity among Down syndrome is the decreased resting metabolic rate. Studies generally suggest that the Down syndrome children's body at rest burns less amount of calories, and ultimately, this may contribute to the development of obesity. Some possible explanation concerns the hypotonia, the muscle type, the composition, in addition to the energy balance. Linking this to the low levels of lean body mass, which the children of Down syndrome generally encounter, the results demonstrate that the genotype may be important in the development of obesity in Down syndrome, and thus the early initiation of resistance and endurance exercises are of clear benefit to the Down syndrome individuals in terms of both cardiovascular and the neuromuscular responses. The administration, in addition to that, to high biological value protein-loaded meals post-exercise play an important role to help increase the muscle mass and ultimately the resting metabolic rate. And thus, the problem of a low resting metabolic rate, in addition to a low level of lean body mass, are generally connected. When we can link these two problems together, when we concentrate as parents, as caregivers, on the initiation of early resistance and endurance exercises, we can help maintain the level of lean body mass and ultimately the resting metabolic rate. In addition to providing proper nutrition for the muscle, for us to maintain the muscle mass that will ultimately also lead to a higher resting metabolic rate. This really emphasizes the importance of physical exercise in Down syndrome, in addition to the parents or the caregivers highlighting the benefits of the physical exercise and the importance of it. 4 is that we have increased generally leptin levels among Down syndrome. We all know that leptin is a hormone secreted by the adipocytes, or in simpler terms, they are the fat cells. And they generally play an important role in regulating food intake by stimulating satiety and promoting energy homeostasis via energy expenditure. In other words, leptin is generally the fullness or the satiety hormone. Leptin generally communicates to the brain that you have had enough fat stored, and thus it curbs your appetite, ultimately signals the body to burn calories normally, and ultimately prevents excessive food consumption. Unfortunately, the increased levels of the hormone correlate to obesity due to leptin resistance, and this is what we encounter in Down syndrome. The increased leptin levels lead to leptin resistance, and thus the body is resistant to this hormone, and thus the body does not curb the appetite, which leads to no signaling to the body to burn calories normally, which in the end increases the amount of excessive food consumption. And in addition to that, studies suggest that the prepubertal overweight Down syndrome children have high levels of leptin, which correlates with increased body mass and the degree of adiposity. And thus, if we really control the obesity at a younger age in Down syndrome, we can really have a very positive effect on reducing the leptin levels and thus having lower leptin in the blood, reducing the chances or the risks of leptin resistance. Moving on to the dysfunction that a lot of people with Down syndrome suffer from, which is the mastectomy or mastication dysfunction. Generally, Down syndrome individuals, especially children, they have issues and they find it hard to eat raw fruits and fibrous foods. Consequently, in general, they prefer softer foods that are generally richer in carbohydrates. Therefore, the high carbohydrate consumption in the daily food intake of these individuals is generally worrisome. This situation may even worsen with the tendency of these individuals for constipation, which is the secondary to muscular hypotonia. And thus, we really need to concentrate that caregivers and parents provide people with Down syndrome or children with Down syndrome with the proper quantities and texture of foods that really reduces the dysfunction or the mastication dysfunction that they suffer from, and they find it palatable in addition to easy to chew and easy to swallow. In addition to the problems that we may encounter in Down syndrome that may ultimately lead to obesity or the risk of overweight is the behavior tendencies we generally encounter. Negativity, impulsivity, oppositional behavior, inattention are generally behaviors that tend to surface as Down syndrome children become older. And these are generally considered as major barriers that prevent necessary dietary and lifestyle changes. Lastly, the short stature. There is no consensus about how to define overweight and obesity in children with a short stature. And thus, the usage of specific growth charts can be helpful to screen and assess nutritional status to provide indication of how growth of an individual child compares with peers of the same age and sex with Down syndrome. And thus, we really need to encounter or take into account that the short stature reduces the amount of calories that we burn, ultimately reducing the lean metabolic rate, ultimately having a higher body weight. And thus, we really need to concentrate on using the proper growth charts that may provide me with proper assistance on how to measure obesity or overweight in children or adults with Down syndrome. And now it's important to manage. How can we manage the problems that we have earlier encountered? 3 main points of interest that we really need to concentrate on. To start with, physical activity. Secondly, dietary consultation. And thirdly, the specifically tailored foods. Let us first explore physical activity. The prevention of excess weight gain and promotion of weight loss are generally the key fundamental promotion needed to manage obesity in individuals with Down syndrome. And thus, we really need to look at the preventive prior to the curative approach. We really need to take a preventive approach. The recommendations to families have to account the cardiac and the musculoskeletal issues associated with the chromosomal trisomy. And thus, we really need to help children that have Down syndrome become more active, beginning by counseling families to limit the sedentary activities such as watching televisions. And also we need to identify barriers to increasing physical activity. Also, we really have to keep in mind that one of the major or the main characteristics that has manifested itself in Down syndrome since birth is the muscle hypotonia, which promotes less flexibility. And thus, parents and caregivers should really carry on and concentrate on the preventive approach rather than the curative approach. We really need to concentrate on finding ways to reduce the barriers to increasing physical activities and ways to reduce the sedentary lifestyle activities that we carry on, such as watching the television or using the smart pads. And lastly, we really need to concentrate on kinds of physical activity like yoga, for example, that promotes flexibility to reduce the muscle hypotonia that Down syndrome people generally encounter. Examples of physical activities include brisk walking, which burns around 100 to 300 calories depending on the speed, in addition to football playing, 30 minutes, that burns around 200 to 550 calories. Secondly, we need to really concentrate on the dietary consultation. The phase of food diversification in these children occurs later, and generally, they really need to concentrate on foods that are easy to chew. Here, we really recommend having health professors or health professionals that may assist the parents with the progression in the texture of the diet, which prevents benefits of the development of the oral cavity of the child. And thus, we really need to concentrate on a balanced diet, which is indicated to all Down syndrome children. Generally, caloric restriction we need to follow to promote weight loss is recommended due to generally their decreased metabolic rate. Keeping in mind that for every 1 kilogram weight loss, we need to burn around 7,000 calories. Body composition analysis really must be carried out to assess the weight and fat loss, if any, occurred. And thus, nutritionists may assist with family education with regards to serving size, amount of macronutrients to consume, especially in those individuals with food restrictions such as celiac disease. We really need to have help from nutritionists or people that can guide us on the serving sizes, in addition to weight loss promotional strategies, and most importantly, analyze the body on weekly or near weekly basis to know where did the weight loss occur and what did we lose. Was it muscle mass or was it fat mass? Thirdly, in order for us to manage the obesity, we really need to work on specifically tailored foods. Generally, when they are born, children with Down syndrome have anatomical and structural differences that make them susceptible to potential food problems. Some of these differences include the reduced production of saliva, which makes swallowing, which makes chewing harder, macroglossia, the small oral cavity, the poor coordination for sucking and swallowing. And thus, it is really our job to provide them with proper foods that are easily digestible, that are easily chewable without having a high caloric and sugar content. Here, it is the job of a nutritionist, dietitian, where she can provide you with proper foods that contain a low glycemic index, having a high fiber content, in addition to being easy to chew and easy to swallow. Sometimes we can change the texture of the foods, and thus it will be easier to swallow, easier to chew, and also more palatable to people with Down syndrome. We generally have 5 nutritional tips for children with Down syndrome. We need to start by keeping our children hydrated. Secondly, eating more fibers. Thirdly, avoiding sugary drinks, avoiding gluten, and let us really be encouraging. To start with, we really need to work on keeping our children hydrated. Generally, children with Down syndrome are prone to constipation. And thus, if the child is not hydrated enough, their large intestines will soak all the water from the food it is being digested. This makes it more difficult to pass by the stools. And thus, the recommended daily intake of water with children varies depending on their age. Up to 8 years of age, they should be drinking 1 liter of water per day. The amount increases to 1.5 up to 12 years of age, and up to 2 liters when they are teenagers. If you want to have a simple calculation, how can we calculate the daily needs of water for my child? We simply multiply the weight of the child by 30 milliliters, having a total amount of, for example, a child that weighs 30 kilos should be multiplied by 3, which equals to 900, and thus 900 to 1 liter, 900 milliliter to 1 liter per day of water are their recommendations. In addition to drinking water, we can generally get hydration and water from food, such as watermelons, pineapples, oranges, berries, green leafy vegetables. All these foods, fruits and vegetables generally have a high water content. Secondly, we need to concentrate on eating more fibers that are easily chewable and digestible. These fibers tend to be water-soluble fibers. And don't forget the thumb rule, which is about 14 grams for every 1,000 calories they eat of fibers. These include apples, berries, avocados, lentils, banana, quinoas, and oats. They all have a high fiber content, but are easier to swallow and easier to chew. Thirdly, we really need to avoid sugary drinks, which includes the sodas, the sports drink, chocolate milk, fruit juices. They generally have a very high amount of sugars, which make it easier for the child to gain weight and be prone to developing type 2 diabetes and heart diseases, not to mention insulin resistance, which directly affects the weight gain. Specifically in children, the risk of becoming obese increases by 60% with every sugary beverage consumed daily. And thus, it is really important to be mindful about how much sugar is your child drinking, since beverages are the biggest source of added sugars, especially due to having a very high content of high fructose corn syrup. This is almost the daily recommended intake for an adult, with the daily recommended intake for adults being about 37.5 grams of sugar. For example, 1 cup of fruit juice, imagine it contains 23 grams of sugar. We all think that juices are healthy. They are healthy, but generally they contain a very high amount of sugar. So we really need to concentrate on that. And thus, we really need to opt for drinking sparkling water, fruit-infused water, coconut water, or homemade smoothies that generally have lower fruit content, lower added sugar content, and lower content of high fructose corn syrup. In the case of gluten, generally, children with Down syndrome are more likely to develop celiac disease, which is an intolerance to gluten that causes the immune system attack to the small intestine. Generally, in a healthy adult, their small intestines and their digestive tract can actually function properly with the presence of gluten. But in gluten intolerance, what happens is that the gluten covers the villi that we have in the small intestine, suffocating these villi and not allowing the nutrients to reach to these villi. And thus, ultimately, these hair-like projections that we have in our small intestine will ultimately die because of the lack of nutrients, leading to the intestine innards becoming inflamed. Ultimately, this leads to the risk of malabsorption of nutrients, bloating, fatigue, and diarrhea. Generally, a gluten-free diet can be varied and fulfilling, which includes fruits, vegetables, eggs, quinoa, wild rice, beans, legume, fish, poultry, whole grain. And we really need to concentrate that these whole grains are gluten-free, and we really need to read the nutritional labels in order for us to be sure that the foods that we are giving to our child is gluten-free. And lastly, we really need to work on the encouragement, positive motivation. Children with Down syndrome often have eating and drinking difficulties due to the low muscle tone that can also affect their face. Many of them have smaller mouths, larger tongues, or a higher palate. All these conditions, they make the coordination, spoon-to-mouth movement frustrating. And so we really need to set aside time for the entire family to sit together with your child so that they can look at everyone and emulate them at his own and her own pace. You may also have to guide their hands for a while. And also, something else to keep in mind is that they learn how to eat independently. They will spill liquids more often due to their lack of coordination. So we really need to have bigger patience. And also, to make the process easier for them, We can provide them drinks in cups with lids at first. They have them sit upright as they drink beverages with a thick consistency, such as smoothies and milkshakes. Eventually, they will overcome their eating difficulties and they will be able to enjoy their meals comfortably. Let us really try to have a preventive approach to managing the risk of obesity. Obesity is the #1 cause of various and myriad non-communicable diseases, which includes cardiovascular diseases, dyslipidemia, diabetes, type 2 diabetes, insulin resistance, and other really diseases that leads to a lower quality of life. Hand in hand, we can reduce the risk of obesity. Let us be more mindful, let us have more patience, and let us really consult people that can help us with regards to serving sizes, amounts of food, caloric intake, and individual needs. I hope you have enjoyed this presentation. It was my pleasure to be part of it. Have a lovely day ahead. Thank you.